I'm Ricky Wirtz, and this is Your Creatures. Thank you for joining us. With us today is Dr. Edward Bennett from the Northview Animal Hospital, and Dr. Bennett's here to take your questions and try to help you have healthier, happier pets. Our first question today came from Tom. And Tom said, my 3-year-old male basset seems to be getting a lot of wax in his ears. Now, I try to keep them clean, but one is looking a little irritated. Is there some ointment that I can use?
Well, Tom needs to take his pet in to see his veterinarian because this is most likely some kind of infection. And dogs and cats there can be individuals that will develop lots of earwax, a lot of cerumen. And they do need to be frequently cleaned out. Other pets don't have much of a problem with that. But if it's not cleaned out on a regular basis, they can develop ear infections. And once that gets set in, then you not only need to clean the ear out, but then you also have to put them on the appropriate medication. Now, dogs and cats can be very prone to having ear infections just because of the anatomy of the ear canal. You know, our ear canal goes straight into the head, but dogs and cats have an L-shaped ear canal. And Ricky, I brought a little model in to show you that.
Great. This is how we learn.
And on this side, it shows the normal ear canal. And you can see with this cross-section cutaway that the ear canal in this dog goes straight down, almost into a blind sac, see? And then it makes this turn.
Like an L.
That's right. And at this point, it's really very much like the human ear. But because of this little L shape, this makes a nice little nook and cranny where bacteria just have a nice, dark, moist environment where they can really set up housekeeping. And if you don't keep it cleaned out, you can see on this side a model of a really severe ear infection that's been very chronic. So what's happened is that not only do you get the infection down here, but it has so much inflammation that the walls of the ear canal have gotten so swollen that they actually occlude the ear canal.
Look at how narrow there.
That's right. Now you can't even get a Q-tip down there. You can't even get the otoscope to look down there.
Wow.
And so it's trapped all that bacteria down there.
Yeah.
So it's real important to never let it get this far, to this stage.
And so get that animal checked
right and there
away.
are ear solutions that you can use. What I usually tell owners to do is to squirt the fluid into the ear and then massage the ear down in this area, and you kind of get that fluid to work its way down into the canal. And I don't like them to use Q-tips except up here where you can see, up in the pinna, the ear flap. That's okay to use a little bit of Q-tips to wipe out some of the wax. But down deep in the canal, they should take a tissue or a gauze square and just reach their finger, because as you can see by this model, you're not going to be able to go further than that blind area. So it's not like you're putting your finger in a human ear. You're not going deep in the canal where the tympanic membrane or the eardrum is. You're staying on the outside part. But you can wipe out all that wax, and over time, you're going to be eliminating all the debris and infection that's down in here and bringing it up to the surface where it can be cleaned out. If they do have an infection, you put the ointments in, and the same way, we use a topical and sometimes also an oral medication in order to clear these ear infections up.
Well, I guess, Tom, you better get in and get that checked, because ear infections, it's interesting because even with kids, I had 2 children. One had ear problems, one didn't. So what are you going to do? Okay, right now, speaking of kids and pets go together. We have a pet. Do you have kids who want a pet? Let's look.